So I'm a father, and so we have a bunch of children's books
Okay.
upstairs that
Mhm,
what we read. One
mhm.
of my favorites that the kids really liked is called "If You Give a Mouse a Cookie,"
Okay.
and it's really fun book about if you do this, then that.
Mhm,
And often in healthcare, and this is where the education piece comes into play, I believe, in healthcare or in general, people go, okay, if I do this, then that, that's great. But that part, that first step isn't necessarily of importance to them,
mm,
but helping them understand, and I hear you, that step may not help, but guess what? If that changes, then this over here is going to change.
mhm, mhm,
And that's the one that really can impact your world.
mhm,
And so that's where that education comes into play. And so now then they realize there's value in doing that first step that
mhm,
they knew of, but didn't
mhm.
realize it was directly connected to that second step, which really impacts their universe.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Larry Estes, who is the VP of Partnerships at Subflow. Larry, thank you so much for being here today, and welcome to the podcast.
Oh, fantastic. Thank you so very much for having me, Joy. I'm very excited for this conversation. Big fan of learning, big fan of healthcare. So it should be a great conversation.
100%. And I would love to start off in the exact same way I start all of these conversations, which is just the guests sharing a little bit more about who they are, what they do, and of course, some context into the company and the problem you guys solve.
Absolutely. Happy to do that. So, just real quickly, I've been in healthcare for a very long time. Um, Kind of got into it almost by accident and found that I really enjoy it. Love the mission, love what we're trying to do. Granted, it's a pretty steep climb at times, but it's a great place to be. So I've
Mhm,
really done a variety of things, both on the clinical side of healthcare, medical devices and pharmaceuticals, as well as the business side of healthcare. So I love it because it really brings me a very wide viewpoint and perspective on some of the issues at hand that we're trying to get out
mhm,
there. As far as Subflow and what we're up to, what we're looking to do is we are impacting patient adherence. And we're doing so by relieving the stress and the burnout on the staff because we're automating a lot of tasks that they have to do
mhm,
manually. So we're putting time back in their day, we're increasing their satisfaction and making them feel more productive. And the patient's winning because they feel like this is a personalized approach. And then at the end of the day, the whole health industry is better because the cost of care goes down. So we put money back into the clinic's hands, we put the time back on the staff's hands, and we improve the clinical outcomes for the patient, which is all win-win-win for value-based care.
100%. And I think a key important thing that you said there is a patient wins. And there's so many things that can get in the, not get in the way, but get added onto everybody's plate. And it's like, yeah, these are all great, but is the end result, the outcome that we're looking for getting achieved, which is, of course, healthier people? And also, oftentimes, I'd love to hear from you if this is something that you guys see as well. I think companies can sometimes be hesitant to adopt new things, especially now in the age of AI and all these things that are happening. Is like, hey, this is just gonna replace our current staff members or do all those things. It's like, no, 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 no. It's gonna make them more efficient and help
Right.
them focus on the things that they're the professional for in the first place. That's what they started doing their thing in the beginning for. So now they're just gonna be able to do that even more efficiently. Have you seen that pattern coming through where people sometimes or companies can sometimes be a little bit more hesitant to adopt something like what you guys have?
Absolutely. Yeah, I mentioned I've been in healthcare for a long time, and often many of those past opportunities have been in software. And there's a lot of reluctance in general by the healthcare community, and I completely understand it. And I believe there's actually a couple of reasons for that, not the least of which, and this is going to sound horrible, but there's a lot of vaporware out there.
Mm,
And there's been a lot of promises made to facilities because it is the newest technology and, oh golly, this is going to be so cool. And holy moly, this is what's going to be awesome. And it misses the expectations. And
mhm,
that's the only time we're disappointed is when reality doesn't meet expectations.
mhm.
And so there's a lot of disappointed healthcare providers out there when they've been promised a lot and it didn't deliver. So
Mhm,
that's part of our challenge is actually proving what we do and letting them see that.
mhm,
That, and in fact, the other piece of the puzzle is there are so many competing priorities in healthcare, and they're trying to figure out where can we get the biggest bang for the buck?
yeah, yeah,
Where should we apply our time and our effort?
mhm,
And there's also actually the other piece of this puzzle that I think about and I talk about and I utilize in my own approach. Healthcare has been so battered with costs. And the
mm,
mindset is typically one of we need to reduce expenses. oftentimes a new solution, as promising as it might be, and as the data is there to support it, it is viewed as an expense as opposed to an investment.
Yes.
And
Yeah.
to help hospitals, help providers, and really we work with Subflow can prove our point and make an impact for payers so that the members actually reduce, lower their cost of care, if you will, because they're doing what's necessary, obviously on the provider side of the fence. So we really play all across both aspects
Mhm.
in our approach. And so once that happens, once they start to see it, I think we're excited about where we're going to go.
Yeah, no, that's really, really awesome. And I think it's important to highlight that as well because there's a lot of noise that exists everywhere. And this isn't just healthcare, this is like any industry, anywhere in the world. Especially now with people and technology, um, people coming up with new technologies every single day. There's always something new that's out there. So it's always like, okay, if there's so many of these new things that I have at my disposal, which one of these things do I pick? And sometimes it's not even which one do I pick is I don't have to pick any of them or I have to pick only one of them. It's just
Right.
really being able to have that right choice instead of which it's like instead of sorry, let me actually rephrase that. Instead of it being a decision and it's like which one of these is the highest priority, it's not sometimes the decision between all of them is just finding the one that can support everything else. Maybe the two, maybe the three, maybe the four. Of course, every company is going to be different, but being able to understand that just because things exist doesn't mean that you have to always use all of them,
Right.
because again, it now stacks onto the expense side. But if you find that one thing that is now a truly valuable asset, a truly valuable piece of technology for the company, and it's no longer an expense. As you said, it becomes an investment. It
Yeah.
allows everything else to flow so much more smoothly. And I'm wondering now, you mentioned that education part for the clients and prospects can be a difficult thing to do. What do you think are some of the obstacles or the hurdles that come from the prospect side in trying to understand something that you guys provide so that they can see it as an investment as opposed to an expense?
A good question. And actually one that I obviously wrestle with every single day that I reach out to a client or a prospect or
Mhm.
whatever. The I'll go back to some very, very um, beginning sales training I had for my first real job. And the sales training that I learned and actually facilitated was called driving principles. There are three driving principles. And the first one is focus on the customer.
Mm.
And then you earn the right to advance and you persuade through involvement. Well, as you can well imagine, that is going to be different for every single one. So when you come to
Yes.
education and understanding what is important to that particular person, even that particular person within a specific organization, because there could be four people that are involved in a decision. Each one of them will have competing priorities of where they want to go and what is of
Mhm.
most importance. And that's
Yeah.
that education comes into play.
Mhm.
And then understand a lot of time that is really the future state. They don't, in some ways, they
Mm.
can't see that because we talk about the competing priorities and everything's just kind of crashing down. They are literally, I use a plate spinning analogy.
Yeah.
You know what I'm talking about? So
Yeah, yeah. The
they're all,
dollars, yeah.
yeah, they're all spinning plates up there. And so they're constantly trying to make sure none of them fall. And sometimes when they've got so many plates spinning, it's hard for them to see, oh, yeah, that's what we can do. That's
Mm.
really where we want to be. And by doing so, some of these other issues and some of the other plates I'm trying to spin may actually go away.
Hmm. You know what? Something that just popped into my mind is that because I've always heard that spinning plates analogy, but the first thing I think of is like I can't even spin one plate, right? So I don't have the skills to spin one plate.
Right.
And even just something that came to mind right now is sometimes a team member might not have call it the right skill set or the right training to spin that specific plate, but then being able to provide something that gives them that flexibility, but also the efficiency into making that task as easy as possible now allows them to spin one, but now not only one, two, three, four, five plates in an efficient way, as opposed to like, what the hell am I doing here? Which
Right.
in my case
Exactly.
is one plate is enough for that, right? So it's interesting. Yeah, I don't. What are your thoughts are on that?
Well, no, you're absolutely right. I mean, I think I people kind of look at me like I've lost my mind when I'm going to tell you this analogy.
Okay.
So I'm a father, and so we have a bunch of children's books
Okay.
upstairs that we and
Mhm.
one we read. One
Mhm.
of my favorites that the kids really liked is called "If You Give a Mouse a Cookie,"
Okay.
and it's really fun book about if you do this, then that.
Mhm.
And often in healthcare, and this is where the education piece comes into play, I believe, in healthcare or in general, people go, "Okay, if I do this, then that. That's great." But that part, that first step isn't necessarily of importance to them,
Mm.
but helping them understand, I hear you. That step may not help, but guess what? If that changes, then this over here is going to change.
Mhm. Mhm.
And that's the one that really can impact your world.
Mhm.
And so that's where that education comes into play. And so now then they realize there's value in doing that first step that
Mhm.
they knew of, but didn't
Mhm.
realize it was directly connected to that second step, which really impacts their universe.
Mhm. It's just basically reframing it for them.
Exactly right.
Very, very awesome. And actually, I would love to ask something about priorities for you when it comes to a lens of growing the business. And
Mhm.
as leaders, I think so often we have a million different things that we have to take care of, right? Hey, we have
We
to
have a
focus
lot
on
of
this.
spinning plates, don't we?
Exactly, right? And then the team member comes in, hey, we need to focus on this, and then on that, and then on this, and then on that. So I always love to ask this question here, which is let's say you had a magic wand, Larry, and you could just solve one challenge, one obstacle, hurdle, whatever you want to call it in the business, that would then allow you to hit all your growth goals, your revenue targets, your client acquisition goals, all those things. But you only get to pick one of those priorities. Things that you can control. So, no, yeah, I'll get a billion in funding. Yeah, sure, everybody wants that. But something
Exactly.
in the day to day that you deal with on a repeated basis. You wave that wand, you get to solve one thing. What's the one thing you want to solve?
So I think, absolutely, like, of course, the funding sounds great, but to your point and to your prior questions, it is one of if I can wave that wand, finding the right client and delivering. I mean, we are delivering, absolutely. We're doing exactly what we said we would
Mhm,
do, but where that client tells the world.
mhm.
Because it's really one of those things where we can talk about it. That's kind of going back to your other question about, what are the challenges in selling to healthcare is it is actually, one of the books I was looking at reminded me of this. They want to hear from other healthcare people.
Sure.
You want to hear from their peers, on how something works. And so if the magic one for me would be one of the clients that we have in place is like, yeah, I will volunteer. I will go anywhere,
Mhm.
everywhere to tell your story
Mm.
because that really eliminates some of the other challenges that were out there.
Hmm. Is there anything that stops you guys? Because I actually agree with you. I think if you have that one champion that really loves what you guys do and is open to sharing that with everyone else that because they know of the value that it can bring, I think it's
Yep.
always phenomenal. But then I always like to think about it in the other opposite end of that coin. Is there anything that stops you guys from getting a lot of those case studies, having a lot of those questions for the client, so then you get more of that clarity, and then all the process following get that as well?
So the first part of our conversation,
Hmm.
right? I mean, it is a risk flat out. I mean, if you and I go purchase something, it doesn't make any difference what it is. It could be a car, it could be a house, it could be our software for our own personal
Hmm.
utilization.
Hmm.
If we don't know, that's the challenge.
Sure.
So you constantly are weighing, is this going to be worth the money I'm going to put out there for this particular product service? And however you want to look at it.
Sure.
It's the same way, even to when working with a pilot. And what's interesting, often they will go, oh yeah, that's exactly that. You're spot on.
Mm,
And then comes the decision point,
mm.
right? Where and this is very, very common in any sort of sales scenario. So it's
Yeah.
not just us and a particular pilot
Hmm.
is, okay, yeah, I'm willing to do it. And that takes trust.
Yeah.
That takes time often. And that's really what the biggest issue is. And we kind of even going back to
Hmm.
the conversation is, or part of our conversation is building that trust.
Yeah.
So they do honestly believe that you are doing the right thing with the right
Mhm.
product at the right time.
Hmm. Yeah, I think trust always becomes that overarching umbrella
Hmm.
above everything else, right? Because sure, you can have the best product, the best, as you said, the case studies are the best team and all the amazing solutions that exist out there. But then if the client doesn't trust you, then all those things go down the drain. But
Absolutely. I mean,
yeah, go ahead.
oh, no, I was gonna say, I mean, it's if all those things go down the drain, and even though the flip side of that is you may know of a particular service, software, whatever. Yeah, I've heard good things about it, but the person with whom you're dealing,
Hmm.
are
Yeah.
they the right representative of that?
Hmm.
You
Hmm.
know, so now then there's this constant mental double check, and that also can be a challenge.
Yeah, and I think that's actually something that gets overlooked a lot of times in business, especially when it comes to B2B. Like B2C, it can become a little bit simpler. Hey, really, this thing is going to be the thing that solves your problems, or all this thing. In business, there's a lot more structure around it. Like if this goes wrong, then oh man, there's a lot that could really go wrong.
Right.
But I think it gets overlooked that at the end of the day, despite all those things on the back end, people buy from people. Right? And there's nothing that we can quote unquote change up until I don't know what AI will look like in 10 years, but at least for right now, at least for right now, people buy from people. And if that's rapport, but I don't think rapport is even the right word. I think that that relationship that exists in the first few steps in the conversation and what leads to a possible great partnership, that's the first turn of the key to then open that first door and then unlock the entire kingdom. Wow, I just got kind of crazy with bars there, but you know what I mean?
But
But
no, you're
yeah,
absolutely correct. I mean, I think
yeah.
people do overlook it, unfortunately, and yeah, there are sales or client facing people that are excellent. You know, are more gregarious than others,
Mhm.
absolutely. But there are plenty who convey that trust, convey that
Mhm.
conviction, convey that comfort,
Yep.
where the person sitting across from them, like, okay, this person, I get it. And,
Mhm.
and then that relationship ideally
Mhm.
grows over time because, well, I remember I mentioned earlier about reality not meeting
Yep, yep,
expectations,
yep.
right? So, but when those expectations are constantly met because they're being set by that client facing representative, now then the client's like, okay, you know what? They said this would happen and it did. And it
Hmm.
might be a small thing. I mean, it might be, sending over a piece of paper, a file,
Yep.
but with the time frame that they said. How does that repeating it over time is what generates that trust. Same thing with our software. We deliver time after time after time. And I'm not saying that it's perfect. I mean, everyone's going to make a mistake at some point in time, and believe
Sure.
me. But how often that happens, number one, is important. If it's minor, that's one thing. But even when it does, how do we or how does that company react to replicate or to, I mean, to correct that problem? And that's also, I think, going back to the whole issue of why our healthcare is so skittish is because I've got plenty of stories of people that will say, I was using XYZ and I had an issue and I called or I wrote and all I heard were crickets.
Mm. Yeah. And it goes back to, hey, nobody cares about the thing truly to then actually help me. It was just more looking for that initial sale, which of course leaves a sour taste in everyone's mouth. So I really love how we're tying everything back. This is like a full circle moment now for the conversation. Larry, I have one final question for you here.
Please.
This has been awesome so far already, but this question is actually not from me. It's a question from our last guest to you, and they had absolutely no idea who you were. So here's my final question. You ready for it? The
Oh
question,
man, this could be really interesting. Yeah,
yeah,
go for it.
this is a bit of a deep one. What kept you from giving up in the most difficult moments in business?
Ooh, it is a very deep one. Um, as challenging as it was, this is for better or for worse, and maybe this is why I found myself in this profession. Um, I can be very tenacious,
Hmm.
and probably to a fault, meaning, you know what, I probably should step away.
Okay.
But invariably, I'm like, no, I am not. And I tell you, obviously, it's related to business, but I see it across my behavior and my approach. It could be solving something here at the house, fixing something, repairing something.
Mhm.
As an example, no, I can do this. I'm gonna get there. And yeah, it hurts along the way. I actually had a personal health issue that would probably go into the same bucket.
Mm.
Um, and I guess it's deep down, I know I can do it, and I'm gonna keep going.
Hmm.
Now, does everything always resolve to exactly where I was hoping or where I wanted? No.
Mhm.
But as long as I can look back on it, and this is something my father used to say to me, is do your best. Angels can do no more.
Hmm.
And so if I do my best and I still don't maybe hit the top of the mountain, I gotta do my best.
Mhm.
And if I hadn't given up when it got a little ugly, when I thought, oh man, really? You said no again?
Mm.
Uh, then I would not be able to frankly look myself in the mirror.
Mm. 'Cause you would
Uh,
know.
and I would know.
Yeah, and that's
I
enough.
would know.
Oh, amazing. I love that. Ladies and gentlemen, Larry Estes, thank you so much for your time. This has been so incredible. Larry, where should people go if they want to learn a little bit more about you and also, of course, a little bit more about Subflow?
Absolutely. Well, of course, go to www.subflow.com. You're going to see a lot of great information in there, including a demo. There's a quick video to see how it works. Certainly, you can reach out to me on LinkedIn, Larry Estes. Very almost must have been one of the early adopters, thank goodness, because that's all you got to worry about is put in Larry Estes, and I'm going to pop up at the top there. And that'll give you some more insight on where I've been, what I'm doing, and obviously would love to have a conversation with you and to ask you a lot of questions is really what it boils down to.
Amazing. I'll leave as many links as I can down below here for Larry and Subflow. And if you enjoyed listening to this conversation, you want to hear more conversations like this, please also hit the subscribe button and I will see you on the next episode. Larry, thanks again for your time.
Oh, thank you, Sean. Really appreciate your time today.
Amazing. Thanks.